Is pornography okay? That's a question many men ask, often quietly, and often with a lot of confusion or shame behind it. Today, we're going to explore that question openly, respectfully, and scientifically. I'm Dr. Emma Blake, urology and men's health expert, and on this channel, I share weekly insights about sexual health, performance, hormone balance, and what it really takes to feel confident in your body as you age. If you find this video helpful, I'd be honored if you subscribed and shared it with someone who might need it. Before we begin, I want to be crystal clear. No one should be shamed for their sexual behaviors, as long as they're not harming themselves or others. Pornography is everywhere. People will encounter it. Some will use it without issue, and others may develop problems with it. So today, let's take a calm, honest look at what the science actually says about porn, its potential benefits, its real risks, and how it affects your brain, your body, and your relationships. Let's start with the basics. Who uses porn? Depending on the study, up to 70–80% of men report using pornography regularly, and about 30% of women do too. In fact, traffic to porn sites increased by 11% during the COVID pandemic. And people use it for many reasons: to explore their desires, to satisfy curiosity, and sometimes because sex education failed to teach them anything useful about anatomy or intimacy. Now let's address the big question. Is pornography good or bad? The answer isn't black and white. For some people, porn is a healthy outlet. For others, it becomes a source of stress, shame, or disconnection. That's why I encourage you to watch this video all the way through, so you can decide for yourself from an informed place what role it plays in your life. Let's begin with the potential positives. Some studies show that people who use porn have more open attitudes about sex, are more willing to explore with their partner, and even report greater sexual satisfaction. In some cases, particularly among women, watching porn has been shown to increase libido and arousal. Couples who view porn together often report feeling more connected and more sexually satisfied. And despite common concerns, there is no clear evidence that pornography causes increased rates of sexual violence, rape, or assault. Multiple large studies have looked at this and found no direct link. But that doesn't mean pornography is always harmless. So when does porn use become a problem? Across multiple studies, somewhere between 4% and 10% of people report struggling with their porn use, meaning they feel out of control, ashamed, or like it's interfering with their life. Medically, this isn't classified as addiction. The term used is problematic pornography use. Let's look at who's most at risk. Watching a lot of pornography does increase risk, but that alone isn't enough to create a problem. What we often see is that coexisting factors, like depression, anxiety, or strong moral conflict, make someone more vulnerable. If you feel guilt or shame every time you watch, you're more likely to spiral into distress. If you begin choosing porn over intimacy with a real partner or over basic life responsibilities, that's a red flag. And if you think your porn use is a problem, it probably is. Let's talk about why that happens. When you watch pornography, your brain releases dopamine, the same pleasure chemical triggered during real sex. But for some people, this dopamine pathway becomes overstimulated. The brain starts craving more, needing novel or more extreme content to feel the same effect. This is called tolerance. And it's similar to what happens with addictive substances. You may also experience impulsivity and compulsivity, strong urges that feel difficult to resist, even when you know the consequences are hurting you. Eventually, your executive function, the part of your brain responsible for decision-making, focus, and motivation, starts to weaken. You may stop doing things that matter to you: going to work, seeing friends, exercising, staying on track with your goals, and you may experience dysphoria, a sense of emptiness, sadness, or anxiety when you're not watching porn. In short, your brain begins to rely on one single source for relief, and everything else starts to fade. Now, How does this affect real life? People struggling with problematic porn use often experience social withdrawal. They stop engaging with friends or family. They may spend more and more money on pornography. Relationships suffer. Emotional connection fades. And in many cases, porn-induced guilt and self-comparison start to eat away at self-esteem. You start to wonder, am I good enough? Why don't I look like that? Why doesn't my partner respond the way they do on screen? And that brings us to one of the most serious long-term consequences: sexual performance problems. You see, many men begin watching pornography as early as age 10, and those early exposures can create unrealistic expectations about what sex looks like. Porn is a performance. It's not real. There are lighting tricks, camera angles, multiple takes, and exaggerated responses. The actors are selected for very specific physical traits. The women are always instantly aroused. The men are always rock hard. The ejaculation volume is enhanced. None of this is representative of real intimacy. And when your brain is conditioned by years of this artificial stimulation, it starts to expect the same level of novelty and response in real life, which can lead to erectile dysfunction, performance anxiety, or emotional disconnection with your partner. If you find yourself struggling in this way, I want you to know, you're not broken. You've simply trained your brain to respond a certain way, and the good news is, it can be retrained. In an upcoming video, I'll be sharing practical steps you can take to reset your dopamine system, reduce porn cravings, and restore healthy desire and arousal. So be sure to subscribe and turn on notifications so you don't miss it. And if you're a parent watching this, I'll also be releasing a video on how to talk to your kids about pornography and why early exposure can have lifelong effects on how they see sex, themselves, and their relationships. Now, before we wrap up, I want to offer a message of encouragement. If you're feeling trapped in a cycle of porn use, shame, or disconnection, there is a way forward. Healing begins with awareness, and it continues with support, structure, and compassion. And if you want to support your body physically while you work on your emotional health, I recommend one more thing: Red Boost. Red Boost is a powerful, 100% natural supplement designed specifically to support men's vascular health, erection quality, and stamina by targeting the smooth muscle responsible for trapping blood in the penis. It's formulated with ingredients like L-citrulline, tonkat ali, maca, and icariin, all clinically backed for boosting nitric oxide, improving blood flow, and supporting male sexual function at its root. Whether you're dealing with stress-related ED, low energy, or simply want to feel more confident in your body again, Red Boost is a safe, effective place to start. If you would like to try it, then the link is in the description below. And if this video helped you, please consider liking it, subscribing to this channel, and sharing it with someone you trust. It's free, but it helps this information reach more men who need it. Your health matters, your sexuality matters, and your peace of mind is worth protecting. Until next time, stay strong, stay informed, and take good care of yourself.